So thank you once more for the opportunity to present my work. Again, my name is Sylvia Ighem Chi. I'm a postdoctoral fellow at Canadian Blood Services under the supervision of Dr. Sandra Ramirez-Arcos. Today, I'm presenting my talk titled Staphylococcus aureus Exotoxins, Potential Biomarkers for Bacterial Contamination in Platelet Components. Canadian Blood Services manufactures and supply platelet components, which are used to treat patients with low platelet counts. Now, these manufactured platelets are stored in glucose-rich media in oxygen-permeable bags at room temperature with constant agitation for up to 7 days. These conditions are very important for platelet functionality. However, they are favorable for the proliferation of any contaminating bacteria. Now, S. aureus has been reported to be the major cause of false negative transfusion events involving platelet components. And S. aureus secretes a compendium of exotoxins, which include staphylococcal enterotoxins that are responsible for septic shock symptoms, as well as staphylococcal superantigen-like proteins, which have been reported to inhibit host immune responses. In 2016, lately in 2020, Canadian Blood Services reported 2 cases of false negative transfusions involving platelets that were contaminated by Staph aureus. This caused an urgent need for novel ways to track down this bacterium and prior to transfusing platelets to patients. So this brings us to the aim of my work, which is to investigate exotoxins as potential biomarkers for S. aureus contamination in platelets. Here I study 4 S. aureus strains isolated from contaminated platelets in Canada and in England. First, I did whole genome sequencing. I screened for exotoxin genes in the various genomes. And next, I did a comparative transcriptome analysis where each of the strains were grown to stationary phase in PCs and in TSB. TSB is the regular laboratory media. RNA was isolated from them, from the S. aureus strains, and it was sequenced. The sequence data was confirmed by RT-qPCR. And all the results, our results shows that the genome analysis shows that all the tested strains encode exotoxin genes. Both enterotoxins and superantigen-like toxins were present in all of our tested strains. And also, it was interesting to find out that exotoxins, staphylococcal exotoxins, were upregulated in platelets compared to TSB. You can see in our RNA-seq data validated by Western blot, validated by qPCR, majority of genes, exotoxins, were upregulated in PCs. Having found the expression of RNA, the bacterial RNA, exotoxin RNA in PCs, I went ahead to look for the expression of the protein of exotoxins. And actually, I probed exotoxin G and enterotoxin H both in TSB and in PC, as you can see these Western blot pictures here. But notably, or in conclusion, we concluded that staphylococcal exotoxins exhibit biomarker characteristics for detecting S. aureus in contaminated platelets. According to the US FDA, an ID biomarker should be readily quantifiable, and we easily detected our exotoxins from TSB and PC cultures. Next, an ID biomarker should have an increased expression in disease state. And our exotoxins passed this test as well, as we found upregulated transcripts in contaminated PCs. And finally, it should be sensitive and specific. Now, published data shows that less than 0.1 picogram per mil of staphylococcal enterotoxins can induce septic shocks in transfusion patients. And therefore, we are recommending the use of staphylococcal exotoxins as markers to detect the presence of S. aureus in PCs prior to transfusion to patients. So on this note, I want to thank everybody on this list, especially our blood donors, the staff at NEDCAF, Canadian Blood Services, and everybody, especially the organizers of this symposium. 'Symposium. Thank you so much. The questions are welcome.
Okay, this paper is open for questions. Peter?
Thank you for your presentation. I have a question. If you have a platelet unit which is infected with your strain, do they have any platelet aggregates in the unit, or does this unit look visually different than regular units?
Okay, actually, it can have aggregates, and aggregates can be absent as well. So when bacteria, especially Staphylococcus aureus, is present, you can see surface-like aggregates that are called biofilms. Some of the strains, S. aureus strains, form biofilms in the platelets. So that might be an indication that this unit is contaminated, but sometimes it's just the platelet aggregates themselves. So some units are not showing that, yeah.
So Sylvia, I have a question for you. How would you see Canadian Blood Services operationalizing testing for endotoxins?
Yeah, that is one big question I'm considering. Yes, that's a very good one. First of all, this is a very preliminary data, though I've outlined some characteristics of biomarkers. So I'm thinking that since we could detect these exotoxins in PC cultures, if we can have something like a serological test, like something like a pregnancy test, but in the long run, but a lot of work is yet to be done on this, that we can actually test the PC prior to transfusion to see if these exotoxins are present or not.
Yeah, thanks. So would you see this as being a big instrument test, or would it be something that the blood bank could do on a, kind of a point of care test format? Okay,
like now like Canadian Blood Services is using the BAC-ALERT system to test for the presence of bacteria of any kind, both anaerobic and anaerobic. But the problem with Staph aureus is that it's so smart that it forms some of them forms these aggregates that hides the bacteria, and they pass without being detected, so they are missed. And so at the level of the blood bank, yes, it could be at the level of the blood bank, or even at the point of care, or before transfusion. We're still figuring how this can work.
Okay, thank you.
Yeah.